All right. Hello, everyone. Thanks for coming to my presentation on the fetal skull, even though you were required to be here and probably had very little choice in the matter. My name is Mikki, and I'm going to take you through the fetal skull landmarks for midwifery skills. So, as midwives, we need to know that there are some different components to the fetal skull. It's not the same as an adult skull. There are 5 bony plates. In between those, there are 4 suture lines. And where those suture lines overlap, there are 2 fontanels. Now we'll get into specifics on each of those categories. I made all these structures out of felt and hot glue. You're welcome, because I come from a long line of teachers and crafters, so here we are. But crafting with my hands helps me learn, so I hope the visuals help you remember these structures too. The bony plates that we're going to focus on are the 2 frontal bones, 2 parietal bones, and the occipital bone. So we have 2 frontal bones, which are visible here, kind of like big Oompa Loompa eyebrows. We have the 2 parietal bones, which are kind of in the midsection on either side, meeting in the middle. And then we have 1 occipital bone on the posterior of the skull. All that to say, you can clearly see the different components and the different pieces that allow molding to happen to the skull during labor. If we are explaining these concepts with our clients, it can address a super common fear among birthing people. They're sitting there like, oh my gosh, how am I going to push this bowling ball out of my vagina? So educating and encouraging clients that the fetal skull is adapting specifically to their pelvis through the molding of those skull bones, it might give them a really very needed boost in their body confidence. That brings us to the suture lines. Remember that the fetal skull has 4 suture lines. So we have the frontal suture, which is also known as the metopic suture. For consistency's sake, I've referred to it as the frontal suture in this presentation. We have the coronal suture, the sagittal suture, and the lambdoidal suture. So here in the very front, we have the frontal suture, and that's extending down from this fontanelle, which we'll discuss later, and down in between the kind of eyebrow area. One study that I came across was using 3D sonograms prenatally to view at what gestation mark the frontal bone is present and when the frontal suture ossifies. So ossify just means bone formation. So that suture basically fuses shut, and the frontal bone is then just one complete piece. So in the study, they found that the frontal bones are visible and appear like thick eyebrows by 11 weeks, so pretty early. And then the metopic suture, that frontal suture, ossifies and closes somewhere in the 3rd trimester. So actually, when the baby is born, this suture line is usually not present. Then we have the coronal suture, which is intersecting that frontal suture there. So this is the coronal suture, and that is where the parietal and the frontal bones meet. So this is the parietal bone, this is the frontal bone, and on either side. Then we have the sagittal suture, just like the sagittal plane of the body, dividing the body into the right and left side, which you'll remember from learning the planes of the body. So the sagittal suture is located in between the 2 parietal bones. So this is this one here. And last, we have the lambdoidal suture. This is formed where the 2 parietal bones and the top of the occipital bone meet. So parietal bone, lambdoidal suture, and the occipital bone. The next components of the fetal skull are the fontanelles. There are 2 fontanelles that we're looking at. We have the anterior fontanelle and the posterior fontanelle. So those are pretty easy to remember. Anterior, of course, meaning towards the front. So we have the anterior fontanelle here and the posterior fontanelle here. The anterior is the larger of the two fontanelles that we're talking about, and it forms a diamond shape. Remember, the fontanelles are formed where the sutures overlap. So we've got the frontal, sagittal, and the coronal sutures overlapping, and that's forming this diamond shape for the anterior fontanelle. When a midwife is palpating, they will recognize that it's the anterior fontanelle that they're feeling based on that diamond shape, rather than the triangular shape of the posterior fontanelle. Over here, we've got the posterior fontanelle, obviously, and it's formed where the sagittal suture here and the lambdoidal suture intersect. And again, that's going to have the more triangular shape. So why is this important? Why do we care? Haha, great question. Thanks for asking. When we ourselves are midwives, yes we are, when we learn how to palpate and do these exams, having this knowledge can be really important if, let's say, there's a holdup in labor and we're assessing what position the baby might be in. So we'll all know these components of the fetal skull. Then sooner or later, we'll be able to visualize them in our head and translate that to what we're feeling in an exam when necessary during labor. And hopefully we'll get a good idea of which way baby is presenting. In one interesting study, I was learning that a large fontanelle measurement may be associated with certain fetal abnormalities, and that information can be helpful when diagnosing some syndromic conditions in utero. So a doctor may see an enlarged fontanelle in an ultrasound, and then that may be a marker for certain conditions prenatally. Even in a healthy infant, there are situations where you may see a fontanelle either bulging or being a little bit recessed or depressed down, and that can be very normal. A bulging fontanelle indicates some increased pressure in the skull, which sounds super scary, but can be really benign. Things like crying, laying down, or even the infant vomiting can cause that increased pressure in the skull and can cause the fontanelle to bulge slightly. Depression of the fontanelle most commonly indicates dehydration. Of course, if there are extreme changes to the fontanelle either way, the infant should be taken in to see their practitioner for assessment. Lastly, on the fontanelle topic, just a really current and relevant article I was reading in regards to COVID-19. This article was from the American Journal of Emergency Medicine and was suggesting that infants presenting with a bulging anterior fontanelle should be considered for a possible case of COVID-19, even if the infant isn't displaying any other classic symptoms. They were referring to a case that they saw where an infant came in, had a bulging anterior fontanelle, and no other COVID symptoms, but the infant did in fact have COVID-19, and the change in fontanelle was a sign of infection. So in the article, they were just urging other practitioners to consider that as a possibility if they saw a similar case arise. Okay, so now you've got all the relevant parts of the fetal skull memorized, I'm sure. So we'll do some quick diagram labeling practice together.